Zygoma implants can be life-changing, not just for patients but also for their entire families. Let me take you through a life story of a patient whom I saw about 8 years ago. So this patient, Sadhana, came from a small village near Nellore. She was about 17 years of age and wearing dentures. She had no teeth because of a syndromic condition. She was wearing dentures, removable dentures, which she would take out every night and keep it away and wear it to school. And she was a happy-go-lucky girl, very bubbly and very good in academics. And then she got into medical college. She got on merit admission to a college in Nellore, the medical college. And then the whole problem started. A shift from a village to a big city, shift from a known environment to an unknown environment, new people, new faces, and she just couldn't accept that she was going to a new place with artificial teeth which were removable, and she had to answer so many people. So after a lot of consideration, we managed to do Zygoma implants for her because that was the best option available for her. So we did Zygoma implants. At that time, she was 17 years and 8 months. And that was, at that point of time, the youngest Zygoma patient in the world. So she had these teeth and she had fixed artificial teeth on top of the Zygoma implants in a matter of 1 week. And she could start medical college. Today, she is not just finished medicine, she is now doing a post-graduation in general medicine. A very confident young doctor. So this transformation was possible because of this advanced technology of Zygoma implants. If you want to know more about Zygoma implants, you can do Google. You could look at so many authentic sources, because Zygoma implants are today one of the most accepted forms of treatment for complex situations. When you have very little bone in the upper jaw, or some bone has been lost because of some tumor surgery or some cancer or because of some accidents, most of the bone is lost in the upper jaw, then Zygoma comes to the rescue. You must have come across a situation of black fungus infection or mucormycosis. This became rampant during COVID times, especially in India. We had several thousand patients who had this black fungus, which predominantly affected the upper jaw, the sinuses, the eye, etc. It was such a dangerous situation that we had to go and remove several parts of the upper jaw so that to save the patient's life. Many of these patients were in the age of 20 to 35. So subsequently, when they needed a rehabilitation, so we had to put some prostheses and teeth, it was a big challenge. So this is one of the very complex sort of situations. The choice was either to do major microvascular reconstruction using bone and soft tissue from another part of the body, or go for implants such as Zygoma implants or patient-specific implants, taking support from the jawbone, which is the zygomatic bone or cheekbone, and then putting artificial teeth on top of it. So we could rehabilitate many young patients that way in a fairly straightforward and simple manner. So Zygoma implants that way have become very useful even in complex situations like what I described now. There's a lot of misconception about Zygoma implants. There's a fear that it is very close to the eye, that it can damage the eye. There's a fear it's a major surgery. There's a fear that many people have not done this sort of procedure. Now let me tell you, Zygoma implants have been in vogue from the year 2001, so almost for more than 25 years. And over the years, there are hundreds of scientific articles reported from different parts of the world, university hospitals, private practices, showing amazing results, 98, 99, 100% success rates. Zygoma implants over the years have progressed. The technology has changed and progressed to simpler techniques, safer techniques. So the worry about eye complications need not be there anymore. The design of the implant has also changed. So with advanced technology coming in, with new designs coming in for Zygoma implants, it's become more acceptable, it's become very successful, and become more patient friendly. So the complications have reduced significantly from what we started in the year 2007. 2007 was the first Zygoma implant that we did in India, when we brought the technology to India. At that time, it was usually used for older patients who had lost teeth and they were wearing dentures, usually above the age of 60. Today, 80% of my patients are less than 45 years of age. There are so many situations where patients lose their upper jaw teeth, parts of the teeth, and also parts of the upper jaw itself. So, in situations like this, the ideal technique to use is a Zygoma implant. And they are time tested and they have been very successful. The complications are less. Acceptance all over the world has increased. I don't think in India we should lag behind. So, those who have the fear of implants, the fear of Zygoma implants, about the unpredictability of Zygoma implants, I think what I have told you now should convince that this has become a very predictable and a very safe and a very advanced, very, very successful technique. Over the years, we have developed a nice team of surgeons, prosthodontists who are specialists in making artificial teeth. We have the support of sophisticated laboratories which do a lot of digital technology. Using all these transformative processes, at Rajan Dental, we have set a team that can deliver quality on par with any advanced international implant center worldwide. So, if you have a question, if you have a doubt, if you have a need, especially regarding Zygoma implants, feel free to reach out to us at Rajan Dental.